Well, my friends, this is the case of carcinoma of the lungs, and the carcinoma of the lungs now it is greatly developed, increased. The lung cancer or the carcinoma of the lungs is now the commonest form of malignant disease among the all malignant diseases. It is commoner in male than in females, and the cause of nearly half of the deaths of cancers in the world in male patients especially. The evidence that cigarette or bidi smoking is the main culprit, is the main responsible factor for increasing this disease, lung carcinoma. So 90% of deaths from lung carcinoma in men result from bidi or cigarette smoking. Cigarette smokers are much more affected than are pipe or cigar smokers. Those who give up cigarette smoking have lower death rates than those who continue to smoke, so that if the habit ceased, the number of deaths caused by lung carcinoma would fall steeply in the course of time. Now, nicotine is the main factor in the bidi or tamak. It contains the nicotine. Nicotine is the main factor. Nicotine is the main substance leading to physiologic dependence in smokers. Nicotine dependence has been classified in different groups. The main culprit is nicotinic acid. So, this gentleman, a poor fellow of the village, farmer, he used to take large number of bidis, and now the adenocarcinoma of the lung is in metastasis form. It has been metastasis into the bones and liver. So this is the terminal stage of carcinoma. The main symptoms are local invasions. The primary symptoms are local invasions. Bronchial carcinoma begins in the epithelial cells of the linings of the bronchus, and gradually growth may enter into the blood stream and form metastasis that is known as secondary deposits in the other organs such as bones, the liver, and in the brain. These metastases may grow themselves and invade other normal tissues of the body as well. The constitutional symptoms in homeopathy are constitutional. Now, the disease also presents some constitutional symptoms caused by the productions of the toxins and hormones by the tumor. These lead to general metabolic changes and to damage the nervous system even. Production of excess hormones may lead to such disorders as Cushing's syndrome. Now, bronchial carcinoma or the lung carcinoma does not give rise to symptoms in the early stage, so that the growth has normally been present for a year or more before than a year. A cough is the first symptom. A cough is the first commonest presenting symptom. At first, it becomes more persistent and with purulent expectoration or sputum. Hemoptysis occurs eventually in most patients. This patient, however, must not develop the hemoptysis. Usually, the sputum is blood stained or contains small blood clots, and coughing up of free red blood is less common in open pulmonary tuberculosis. The shortness of breath. This patient developed very shortness of breath. শ্বাসকষ্ট খুব বেশি হচ্ছে, দম নিতে পারছে না. So gasping respiration and shortness of the breath is a prominent feature usually associated with the productive cough. The dyspnea can become severe if there is added infection of the lung collapse. Chest pain may be caused by pleurisy or by the growth invading the ribs of and the intercostal nerves when affected. Wheezings may be present due to bronchial obstruction, and hoarseness of the voice may be due to pressure on the recurrent laryngeal nerves may develop slowly. So this is about the lung carcinoma, and this present is also at the terminal stage of disease. Now the incidence already I have mentioned, the incidence of the lung carcinoma increased dramatically during the 20th century as a direct result of the tobacco epidemics. So this patient, according to homeopathically, requires lycopodium. These are for sweets, and these are for warm foods. And considering the physical makeup, constipation, etc. So I prescribe lycopodium in 50 millimole scale of potencies once daily in the morning. Let's see the result. I shall share you, my friends.